Well, now to the very latest on Oregon's largest healthcare workers strike in state history. Today, Providence says they are ready to schedule negotiations with all 8 hospitals, including the 2 largest here in the metro, Providence Portland and Providence St. Vincent. So there's some movement towards resolution, but this is just the scheduling of talks between the 2 sides. But it's a step forward nonetheless. The union responded today claiming that the pressure from the strike is now working, that Providence is ready to talk. The Oregon Nurses Association claims that Providence is spending more than $25 million a week on replacement nurses. Interesting to note, though, that the strike has not been going for a week yet. It's just day 5. But it's just another example of the war of words between the 2 sides. The union says they will release information on the details in their proposals, quote, in the coming days. All right, now let's get to some of your thoughts following our coverage of the strike last night. We had a live interview with a rep from the Oregon Nurses Association to hear their side of this story after we previously heard from the chief executive of Providence on Friday. And we got a good mix of responses from you. Some in favor of the strike, some against, even some patients who find themselves caught in the middle of all this. Now let's start with those who agree with the healthcare workers on the picket lines. Dixie wrote to us, "I support the doctors and nurses. They are at ground zero and know what the patients really need. The administration of Providence care about the bottom line first, doctors and nurses second."
I am the wife of a patient who had surgery scheduled this week with Providence and canceled it because of the strike. I am always in favor of unions. Providence proves that it is a business, it's about making money, and it has nothing to do with health care because they're only interested in making money.
But there are certainly those of you out there who do not agree with the strike. An anonymous viewer wrote, "Nurses are spoiled. How can hospitals possibly keep healthcare costs down when unsustainably generous sick leave, vacation, and Family Medical Leave Act policies can be abused by staff with complete impunity? These abuses result in staff shortages, especially on Fridays and Mondays. Unions don't fight fair." And then there are the people who, one could argue, are the most affected by this strike, patients, and those needing to see their provider at one of the Providence locations. We got an interesting voicemail from a viewer named Rick about just that.
Your interview with the nurse from Providence about the strike and about some of the things that are going on at Providence, as a patient there, it really has got me concerned. Am I going to the right place for my health concerns? Well, I'll tell you, it really put me in a place where I'm just wondering if I should go back to where I was at previous to this.
Rick, I'm just going to guess that you're not alone in wondering that. We've heard from a few people in our email inbox who are having trouble scheduling appointments because of the strike, delaying their care. But let's end on this nice email from a viewer named Terry. "Thank you for reporting on all parties who are impacted by this strike. As we know, there are at least 2 sides to every story, and the truth lies somewhere in the middle. You do a great job trying to keep your audience focused on the truth." Well, that is our goal. Our little team here works hard every single day trying to bring you balanced coverage of issues that you care about, and we'll continue doing that day in and day out.